Recording. Hi, I'm Rachel Ruhlen. I'm a transportation planner with the Roanoke Valley Allegheny Regional Commission.
And I'm Amanda McGee, and I am a regional planner with the Roanoke Valley Allegheny Regional Commission.
We're going to tell you about the bicycle and pedestrian count programs of the Regional Commission. We count people who walk and bicycle on roads, sidewalks, greenways, and trails. Walking and biking have so many benefits for our community. Everyone knows that exercise is healthy. Walking and biking is good for the environment, and today is Earth Day. The more people who walk and bike and the less they drive, the less pollution we have related to transportation. More and safer walking and biking make a community more equitable because people with low incomes rely on walking and biking to get around and to get to bus stops. Many studies have shown that walking and biking is good for the economy, and walking and biking are fun. Counting people who walk and bike helps us make it easier for you to walk and bike. More people walk and bike when we have safe places for them to walk and bike. Cities and counties can build these safe places like sidewalks, bike lanes, greenways, crosswalks, pedestrian signals, and curb ramps, but they need funding. Bike ped count data make their grant applications stronger. It helps them justify new projects and the staff to support these new projects. Plus, we're just beginning to explore how we can use this data to support economic activity and public health. To count walking and biking, we need to answer 3 questions. Where do we count people who are walking and biking? How do we count them? Who analyzes the data and pays for the equipment and the staff time? But this map shows a lot of the locations where we have counters. The green dots are counters on greenways and trails, and some of these have been there since 2010. The purple ones are on streets, sidewalks, and bike lanes. How do we count? We use automated counters. These include these gray boxes that are attached to lamp posts, signposts, and poles. These are infrared counters that detect heat sources, but they can't tell if the heat source is coming from a bear, a person, or a car. So we have to be careful how they're pointed across a sidewalk, a greenway, or across a dirt path, such as this one along Ogden Road. They can't tell if that heat source is coming from a person who's walking or a person who's bicycling. So we also have counters that count only bicyclists, and these can be used by themselves or in conjunction with the infrared counters. These bicycle counters are wire loops that were taped to the greenway at River's Edge. Just the same kind of wire loops are embedded in the pavement on the Memorial Avenue part of the Roanoke River Greenway and in the pavement of the bike lanes on Memorial Avenue. We've also used these pneumatic tubes that you see here taped along Elm Avenue in those bike lanes. Who pays for it? Well, we staff at the Regional Commission collect, analyze, and share the data. The Virginia Department of Transportation, Virginia Tech, and the Greenways have provided a lot of the equipment. Roanoke City, Roanoke County, Salem, and Benton have given us permission to place the counters, helped us determine where to put them, and helped us install the equipment, and they're very interested in the data. Campbell Avenue is one of my favorite count locations because of this regular weekday heartbeat. The low point every Sunday, and then a peak every Friday or Saturday, every single week. So these counters I have on Campbell Avenue also show the impact of downtown events. From an average of 1,672 pedestrians per day walking past one of my 2 bike counters, we had almost 7,000 people on St. Patrick's Day, even though the parade was canceled. You can also see the peaks of that happened at the Dickens Christmas events in December. Downtown Roanoke Inc. and the downtown businesses are very interested in this kind of data. They're also interested in this data. This graph shows the daily traffic patterns, pedestrian traffic patterns on Campbell Avenue, and the orange is 10th Street. So in order to compare the traffic patterns, because these 2 locations have very different volumes, pedestrian traffic volumes, you see Campbell Avenue has 160 people at its peak, and 10th Street has almost 7 people. I had to use these 2 different axes, Campbell Avenue on the left and 10th Street on the right, to be able to compare the 2 shapes of these curves. Campbell Avenue has a prominent lunch peak, but it doesn't appear to have the morning peak and the evening peak that's a more typical commute pattern, or does it? You see at 8 a.m., we still have a lot of pedestrians, about 60, and at 5 p.m., there's about 100 pedestrians. The morning and evening peaks are actually there. They're just drowned out by this lunch peak. I was curious to know what effect the pandemic and everything closing would have on downtown traffic. So I looked at the average, for each hour of the day, the average traffic from February 15th to March 15th, before everything closed down, and the week before last, well into the closures. This is at Campbell Avenue. You see, the lunch peak hasn't completely vanished, but it's so attenuated, you're starting to be able to see the morning peak and the evening peak. But traffic all over is down, and you can really see that the nightlife stops at 9 o'clock. We just don't have a nightlife downtown right now. Compare that to downtown Vinton, much lower traffic. Again, we have not quite 5 pedestrians in a single hour at that location, but these are for the same time periods, the before and the during the closures, and you see almost no difference in the two curves. So although this is bad news for the economy, this data show that social distancing is definitely happening downtown. I hope I'll get to add after data to these graphs soon. And now Amanda is going to discuss the Greenway data.
Thanks, Rachel. So as we've seen, we can use the information we collect in our count locations to better understand users and make some assumptions about what is driving folks to bike or walk. Memorial Avenue Bridge is one of the places where we can make apples to apples comparisons of on-road traffic, so like bike lane users, versus off-road traffic, so greenway users specifically in this location. Some takeaways that we can kind of derive from this graph, which compares those two numbers, are that more people are using the greenway than the bike lane at this location. One of the possible reasons for this could be perceived safety. It could also be the manner in which people are using their bicycles. We see strong weekend peaks on Saturday and Sunday, and that shows that the greenway use, as we can imagine, is driven by recreational users. We can compare different user groups a little bit by looking at some of our different greenways and guessing how they're being used based off of the patterns of day of the week information. So on this slide, we see 2 different greenways. That's Mill Mountain Greenway in black and the Lick Run Greenway in blue. And for those of you who are familiar with these facilities, it's probably not a surprise to see the strong Saturday and Sunday peaks on Mill Mountain Greenway. There's not really anything to commute to on this greenway. Is a recreation-driven facility versus the numbers on Lick Run Greenway, where the averages remain pretty steady throughout the week. And we can guess that maybe we're seeing some commuter traffic here, people who are not necessarily working standard 9 to 5s, or that we're seeing more local neighborhood traffic. If we look at Roanoke River Greenway is what most people think of when they think of the greenway in the Roanoke Valley. And that's not really a surprise when we look at numbers like this, which show that about 3/4 of the traffic that we counted in this in Roanoke River Greenway over the time period from June of 2018 through June of 2019 is happening at River's Edge, which is right next to Carilion. That's 3 times more traffic recorded at this site than the 3 other sites combined. And so we can guess that most of our user conflicts are happening at this location. River's Edge also is the most connected stretch of the greenway, so that can lead us to make some assumptions about why this is the most popular area. It has driven economic development. There's a lot of businesses that are along the Greenway and this stretch, and that in turn drives traffic. So a lot of businesses and residential units like the Wasena City Tap Room and the apartments there, like the Roanoke Memorial Hospital. So this Greenway, this stretch of Greenway at River's Edge is really important to get numbers on because it's the place, as mentioned, where we have the most user conflicts, we have the most volume of users, and we want to learn how to manage it. So one of the things that has happened recently in our news, of course, is, as Rachel mentioned, we can see some differences in numbers in the pandemic, and specifically relevant to greenways in the city of Roanoke. We can look at how traffic has changed from before the pandemic. So the Saturday before the pandemic at Memorial Avenue on the Greenway, we had 843 people. At River's Edge, our most popular location, we had 2,174 people who walked by this single point over the course of the day. And after the city decided to close the greenways to encourage social distancing, we see a sharp drop in both cases. So, kind of in conclusion with all of this data, we know that having bicycle and pedestrian traffic information about how many people, how many trips we're recording at these locations can provide very useful information on how we invest in building new facilities and improving our facilities, our sidewalks and bike lanes and greenways, and how we manage them, and also that this feeds right back into questions of economic development and public health for our community. And we want to continue to pursue these opportunities going forward to really have a better understanding of all of these relationships. And in the process, continue to build the argument for our community that walking and bicycling should be prioritized because it's what we need for a healthy and sustainable and equitable community going forward.